And that's how I lost my medical license. Welcome back to the HUD channel, where they have graciously agreed to continue to tolerate my existence, and to episode 2 of Beyond the Bench, Emergency Field Medicine. In this episode, I will be going over some of my more advanced medical supplies and their applications. Most injuries can be treated, temporarily of course, with the 4 items in front of me. Well, 4 items and accessories. A combat application tourniquet, a Olays modular bandage, burn gel, and a combat splint. In this video, I'll briefly be going over the purpose of each item. So starting off with the combat application tourniquet, or CAT. It is designed to reduce or completely cut off the blood flow to a limb or portion of it. It can also be used in the case of a bite to slow the spread of venom from the affected limb to the rest of the body. Volunteer! I will now demonstrate how to apply a combat application tourniquet.
I need healing.
So after unrolling it, you do need healing. Relax, you're in good hands. Make a loop. Let me see your arm. Put it above the injury. Wrap this all the way down and crank. Twist the pressure bar and wrap to keep in position. There you go. Few tips about using a combat application tourniquet. In the case of an amputation, make sure to put it a few inches above the actual nub, because in the case of trauma, the veins will actually retract into the body. So you won't be able to stop bleeding if you're not high enough. He needs healing. Get on out of here. All right. Burn gel is rather self-explanatory. Let me get my practical member up here. Show them your horrifying injuries. Give them a good scream.
Oh, God!
Okay. Burn gel is rather self-explanatory. As a gel, simply apply generously to the area. They should feel immediate relief. Take a gauze pad, cover it gently, being careful not to apply too much pressure, as pressure could aggravate the wound or cause pain. Rolled gauze, wrap gently. This will protect the wound and keep the gel pressed into the burn where it can do its best work. Now you get to watch my really painfully slow bandage wrapping. It's okay. You're in good hands.
Feels much better now.
Okay. So then you just tuck that up in there. And there you go. It's even easier as a burn pad. Rip the package, pull out the mucusy, disgusting looking.
Yum.
Yeah. Oh yeah. Slurp that right up. Apply to the area.
Exfoliating.
Comforting. Gauze as well, just because it's a good idea. And do the same thing. We use a lot of rolled gauze here, and I mean a lot.
Well, at least I won't need to put on moisturizer today.
Huh. You will if the skin grows back. It's not looking good. You're welcome. There you go. That's how you handle burns. Moving on to the combat splint. It's also pretty straightforward to use. To use it, to prepare it for use, you're going to go ahead and unravel it, roll it into a C shape, and let me get my broken arm! This is Rachel. She has a broken arm.
Hi.
Okay.
This hurts a lot.
Okay. Rolled into a C. You'll take it, put it around the break, make a fist, please. Yeah. This is how you aggravate the break right before you, the healing's not as good as the hurting. Okay. So you have it splinted, and lo and behold, more rolled gauze. Rolled gauze is gonna come around. You're doing really good for a break.
Ow.
Shh. Let the doctor do his work. I'm not actually a doctor. Okay. So, is this the most attractive looking thing? Well, no, but you'll be alive, and that's something. So there you go. Now you have it splinted. Again, be as gentle as possible when applying it, because the last thing you want to do is aggravate the injury.
Why are you shaking it? It hurts. No.
Okay, thank you. Now, onto the last piece of medical equipment. The Olays modular bandage. It is a multi-purposed, vacuum-packed trauma bandage. As you can see, the outer trauma bandage has a pocket on the inside with packed gauze and an occlusive dressing. Additionally, it has a pressure bar which can be used as an eye cup. Give me my sucking chest wound! All right, we have 3 injuries here. We have an ocular injury, a horrifying scratch, and a sucking chest wound. We're gonna treat all of these with this bandage right here. Sucking chest wound, simple enough. You can tell that it's a sucking chest wound because normally it'll go. Because what happens is the lung, there's a negative pressure inside the lung, so it can't inflate properly. So he's suffocating right now. Simplest way we fix that is we take our film, press it over the entire area to make a seal, duct tape. We're going to tape up 3 sides, not 4, because we don't want to give him tension pneumothorax. Hey, buddy, how's it doing? Does it hurt? Hurt a lot?
I need an adult.
I am an adult. This is a little known fact. You can save someone's life with this. And that is the ghetto way of doing it. The even ghettoer way, you can take a fancy credit card. Sorry. You can take a fancy credit card and do the same thing. Press it over the wound. I'm gonna watch you suffer for a little bit. And 3 sides. And he'll be able to breathe. It forms a one-way valve, so he can breathe without it killing himself. Okay. For our ocular injury, we actually are going to need to remove the pressure bar right here with a knife. Hence why it's important to have one. So taking this, putting the part out, we're going to place it over the eye and take the Z-packed bandage. You're fine. Keeping it up over the good eye. We're going to wrap this around. Making sure to get the other part of the face as well, because what we're just wanting to do is get that covered and get it safe and get some pressure on it by wrapping it. Ocular injury treated. Finally, for the scratches, we're going to use the pressure part of this bandage. Simply hold, press directly onto the area you need pressure. You'll undo. Oh, son of a bitch. I've killed you. Press onto the area, undo this part, and roll. Roll, roll, roll. Put some big old pressure on that, as much as you can do. Because what you're trying to do is get direct pressure on this area to stop that bleeding. Roll it in like this. Take the tooth retainer, come into these 2 areas. Problem solved. You've saved a life. So not only can you use the Z-back gauze for wrapping, you could have also packed that with the gauze before applying it. Could have done a variety of things. Okay, hop on out of here.
I'm actually also blind in my right eye, so I can't see where I'm going.
Why did you do it on his good eye? I'm surrounded by idiots. Well, that does it for this episode. I'd like to take a moment to tell you to like, comment, and subscribe to the HUD channel for all future episodes of Beyond the Bench. I'd also like to thank my volunteers. who volunteered by being dummies for this video, and Rachel, who did all the makeup.
Follow my voice.
We like to have fun here. But I'd like to remind you, remember what you've learned here. It may save your life or the life of someone you love. Say bye, everyone.
Bye.
I still need you.